Hi guys, Jean Marie again. Um, now we're going to be talking about the care of the patient with vascular problems, and this is in chapter 36. So first of all, again, our learning objectives, which you can read through on your own. Um, we're going to be talking about providing care for the patient with perfusion and clotting disorders and problems. We're going to talk about patient care with vascular problems affecting perfusion and clotting. We're going to talk about patient education, about their medications, about lifestyle changes. We're going to talk about nursing interventions to promote perfusion and to prevent complications such as clotting. We're going to talk about the assessment and the lab data needed with these patients and the nursing interventions to decrease the psychosocial impact of dealing with chronic vascular disease. So, we're going to start out talking about hypertension. Hypertension is the most common health problem seen in primary care settings. It can lead to stroke, MI, kidney failure, and death. Even though the book gives different values, the newest guidelines, and they're really not all that new. In fact, I looked at the copyright date on our book, and the new guidelines are 130/80, and we've been following those guidelines for, I think, 2 years now. I could be wrong. Days and months and years run together sometimes, but it's been a long time. I want to say 2 years, even though the book it states a different time, a different value. But we will be responsible for knowing that the newest guidelines say that anything above 130/80 is considered hypertension. We're going to talk about treating adults with medications, and we're going to discuss how it's a worldwide pandemic, but it also is very prevalent here in the United States. So moving on, what is blood pressure? Well, when we're talking about hypertension, we're talking about arterial blood pressure. And when you look at blood pressure, you need to look at both the cardiac output and the peripheral vascular resistance. And that's the vessels, how they can, whether it's constriction or dilatation. Therefore, anything that increases peripheral vascular resistance or your heart rate or your stroke volume increases your blood pressure, and vice versa. So anything that decreases vascular resistance or decreases heart rate or decreases your stroke volume would lower your blood pressure. The 4 mechanisms that help stabilize the blood pressure, and I'm not going to have time to go into detail on these, you covered these in patho, are your arterial baroreceptors, the regulation of body fluids. Here is that renin-angiotensin-aldosterone system again, and vascular regulation. All of these are very important, and it's how the medications that treat hypertension, how they work on the systems that they work on in order to control hypertension in patients. Culturally, control of the blood pressure has resulted in a decrease in the cardiovascular mortality and morbidity here in the United States, but it is still a silent killer. African Americans still have a much higher rate in the U.S., and this population tends to develop hypertension earlier. And they also, people of African descent who live here in the United States are even at a higher risk of developing high blood pressure and developing it earlier. And the etiology is unknown than people of African descent living other places in the world. As far as gender goes, there is a difference in men and women. Under 45, men are more likely to have hypertension. Between 45 to 64, it kind of evens out. And then over 65, it's generally more newly diagnosed in women. Table 36.2 is very important. It talks about Healthy People 2020 and the objectives related to hypertension and blood pressure that to control that in the populations. But remember that hypertension is still called a silent killer. A lot of times people are very asymptomatic with it. So even though the doctor says, your blood pressure today was 180 over 90, and we're going to put you on this blood pressure medicine, even though it's very inexpensive, or even though it doesn't cause them any side effects, they may not take the blood pressure medication. Or they'll start taking it and then they'll develop side effects from it, whether it's a dry, hacky cough or sexual dysfunction. And instead of going back to the doctor or their care provider and discussing alternatives, they just quit taking it, and their blood pressure continues to worsen. Hope that makes sense. So what are the classifications of blood pressure? Well, when we look at it, it is important for us to look at the table on 36.1. And that will help us with the different causes of essential and secondary hypertension. Now, essential or primary is the most common, and is not caused by an existing health problem. It's usually caused by lifestyle or can be caused by genetics. It is consistent elevated blood pressure that leads to the thickening of the arterioles, decreasing the perfusion, leading to organ damage, and increasing the risk for MI, stroke, peripheral vascular disease, and death. So because that's one of the reasons that providers are starting to treat blood pressure more aggressively earlier, is to decrease the damage caused to our bodies when it has hypertension, while we're trying to decrease some of the other risk factors that are changeable, that are modifiable. Secondary or specific disease secondary hypertension is hypertension caused by a specific disease, such as kidney disease, or medication, such as estrogen, or a state. Remember, pregnancy is not a disease, it's a state. That's considered secondary hypertension. Malignant hypertension is a severe type that is rapidly progressing, and it's usually people are very symptomatic, and the blood pressure continues to rise. It usually starts with systolic over 200 and diastolics in the 150 range, and this is a life-threatening emergency.